Yes, EFAD is a very important part, I think, of the conference because we represent something like 35,000 dietitians across Europe. So dietitians are involved in counselling people to help them think about what they're eating wisely. Dietitians work clinically with people who are unwell, and we have to think about their hydration. But also they work across the piece, so they work in industry, they work in research, and they also work in the community and public health with schools. EFAD, of course, is really committed to helping dietitians across Europe learn more about the evidence for healthy hydration. And this UHAC campaign, as we call it, is going to do that because what we've done is we've already surveyed dietitians to find out what they know about healthy hydration. And from that survey, we've learnt that there are areas where there is a deficit in knowledge. And from that, we are putting together educational materials to allow dietitians to understand more about hydration and what messages should be given within their communities and within their practices. So as part of the UHAC campaign, having found out where some of the deficits were in dietetic knowledge, we then put together a webinar for dietitians. Webinars are really super tools to use because we had over 400 dietitians from across Europe register to take part in that webinar. And we then carried out a questionnaire afterwards. And I think of the 100 or just over, more than 70% of dietitians answered that questionnaire and found it to be absolutely what they needed to know, which is pretty good. That's a high rating for feedback on a webinar. But the other interesting thing is, from that, now we've got all sorts of other ideas for other webinars. So we're going forward with that campaign even more.